Today we're going to talk about how to prevent arthritis flares. We have another video about arthritis flares and how to treat them when they happen, but if we can prevent flares from arthritis, particularly inflammatory arthritis like rheumatoid arthritis, psoriatic arthritis, and so forth, that's all the better. So brief review, as usual, rheumatoid arthritis kind of is our standard bearer of inflammatory arthritis, but similarities to our other forms as well. Rheumatoid specifically is an autoimmune inflammatory form of arthritis. It causes pain, stiffness, and swelling in joints and affects about 1% of the population, more commonly in women than men. We have no cure but excellent treatment. So our goals for treatment remain no pain, no stiffness, no swelling, and really a normal life. And typically we do that with a class of medications called DMARDs, stands for disease-modifying antirheumatic drugs. To learn more about all the different types of DMARDs, we have information on our website as well as multiple other videos available. But what we want to focus on is flare and rheumatoid arthritis flare. So what is a flare? So a rheumatoid arthritis flare is when the arthritis previously well controlled becomes active for some period of time. And that might be a few hours, a few days, or a few weeks. You have more symptoms during that time, so an increase in pain, stiffness, swelling, fatigue. And it might be one of those things. It could be lots of those things. A flare can be unpredictable, can happen whenever, but it might happen in a very predictable sort of way that you know when you do something specific that that's likely going to bring on a flare. And that might be different for different people. And as we said, a flare can have varying length and varying frequency in terms of how often they happen and how long they last for. And that's going to be different for different people. But what can we do to prevent those flares from happening in the first place? So probably the number one thing is to ensure our rheumatoid arthritis or inflammatory arthritis disease control is excellent, that it is as optimal as we can make it. And that means having those discussions with your rheumatologist, your rheumatology team, to make sure that we're doing everything that we can appropriately, safely, to ensure that your arthritis is well controlled. And that's really looking at your disease-modifying agents and making sure that they're absolutely the right ones for you and doing what we want them to do to essentially get your disease into full remission. And as long as it's in that deep remission, the chance of flare is going to decrease. So we really want to have optimal disease control. That's going to be our baseline for preventing flares. But there are other things that we can do day to day which are going to help ensure that we stay in remission and reduce the chance of those flares. So what are some things that we can do? So smoking is a big one. We know that smoking does not help inflammatory arthritis. We know that those who smoke have an increased risk of developing rheumatoid arthritis in the first place. But even once that happens, being able to cut back on smoking or stop smoking altogether is going to make a big difference in terms of your arthritis itself. Those who are able to cut back or stop smoking, their arthritis probably isn't as bad, it's not as severe, and it also allows the medications to work better. So in other words, less severe arthritis with medications that are more effective are going to decrease your risk of a flare. We know weight control can help. So if you're a little bit overweight, probably means the medications aren't going to work as well. It also allows your immune system to be a little bit more active as well. And that corresponds well with exercise and activity. We get questions often of, can you exercise if you have arthritis? Absolutely. Being active is a good thing for your overall health. It's a good thing for your joints. We always want to listen to our body. If it hurts, we need to back off or find different forms of exercise, but we do want to be active with arthritis, and we know that activity is going to help weight control, it's going to help our overall health, and those things help prevent flares. What else can we do? Dental hygiene. So this might not be one that we often think about, but having good, healthy teeth and gums is actually going to likely help your arthritis as well. There's growing data in terms of this concept called the gut microbiome, that perhaps different bugs in our body might be having some impact in our immune system, and therefore things like arthritis and so forth. And certainly our gut starts in our mouth, and there's lots of potential bugs and infection things that can happen in our mouth. If we're able to have clean teeth, less cavities, good healthy gums, those sorts of things are likely going to help our arthritis as well. Stress management. Stress in our life for any of us isn't good, but certainly if you're more prone to having flares of your disease, being able to manage that stress is going to help in terms of preventing, but also probably managing the flare itself, because we don't want to get too high or worked up in those situations. That doesn't help our overall health in terms of how we perceive pain, stiffness, swelling, and that sort of thing. While infections themselves aren't going to cause a flare, they certainly aren't going to help in terms of our overall health and so forth. But there are things that we can do to reduce the chance of that. That includes making sure that we get our flu shots every year, these days with COVID shots as well, and just being smart in terms of our overall infection risk. That's not to say that we need to be wearing masks all the time or really prevent or stop ourselves from doing things day to day. We want to live full active lives. That is healthy, but we just want to try to be and remain as healthy as we can. That's really important in terms of arthritis. And finally, and we talked about this at the beginning as well, we want to work with our team, our rheumatology team, our rheumatologists, and all those involved to be able to discuss these things in much more detail than we've talked about here today, and make sure that we're doing the right things for you. Everyone is a little bit different, and everyone needs different emphasis and different priorities in different areas, and your rheumatology team can put a plan together specifically for you to help reduce the chance of flares, but also, if those flares happen, to be available to ensure that they are as short as possible, they are less severe, and then from there to hopefully prevent those from happening again. For more information on arthritis or on treatments on anything related to rheumatology, feel free to check out our website or watch our other videos from albertarheumatology.com.